the word around. Any earners and nothing scares me.
Yep. Thank you.
Thank you, guys.
Thank
Yep,
you.
appreciate it. What did you have? Pfizer?
Pfizer.
Yeah.
Pfizer, yeah.
So CEO, obviously they had the first vaccine. It was the only vaccine that's now been approved fully by the FDA. Pfizer CEOs, they're like, we're working to develop because you got to have treatment. Vaccines are part of it, but you also have treatment. I think this is a good, and this is not uncommon at our sites to have folks who were fully vaccinated come in and still need treatment. And I think that the treatment got to be a part of how we're looking at treated. And early, the success rate is very, very high with the monoclonal antibodies. And so I'm going to have Ken Shepke, our Chief Medical Officer for the Division of Emergency Management, come up. And we are looking at, the Regeneron has been very, very successful. That is something that the federal government purchased, and so we get it free. You also have the one by GlaxoSmithKline, which has had very good track record so far. It's newer. So we're looking to see how that's going to be utilized by health systems, see if we can expand the footprint of that in Florida as well. And, they've also just kind of reapproved the Eli Lilly monoclonal. They had kind of taken that back for a couple months because they weren't sure how that was working against variants. So we'll also look at that too. But, the Regeneron one has been very effective against Delta. And the GlaxoSmithKline in the studies and the tests have been very effective against the Delta variant as well. Okay, Ken?
Thank you, Governor. I think the take-home message is COVID is a treatable illness. These monoclonal antibodies, period, physicians have been using for years. And I know a lot of people don't know a lot about them, but this is a great safety track record for the years that we've been using antibodies, and you can use it to target any number of illnesses, and obviously we're targeting COVID with this. They work fantastically, but the message is, if you're a high-risk individual and you test positive, you should be thinking, where can I go get the treatment and get it early? Like all things in medicine, early treatment works better than late treatment. You can't wait until you're really, really sick. So don't wait for those really bad symptoms to show up, because then it may be too late for the treatment to work for you. So the governor set this up around the state. It's now very easy to get these things. As the governor mentioned, there are 3 options. We're using Regeneron because it has some unique properties, such as being able to use for post-exposure prophylaxis, subcutaneous injection, which makes it a lot faster. You got a lot more people through. And the federal government's already bought this. So this is free for patients. So this is a great treatment for vaccinated or unvaccinated individuals. Makes no difference. If you're high risk, I encourage you to get this treatment. As you've heard, it works really, really well, and works even better if you get it early. Thank you very much.
And so this site can do, we'll be able to do over 300. I would say of the 22 sites that have been operating for a while now, I would say probably there's 2 or 3 that will hit 300 routinely. Most of them typically do probably between 150 and 200, which just means if you need it, likely not going to have to wait. We also have seen the last few days a decline in the people going to get it, but we think that's probably just a reflection of less incidence of infections, and so that's not necessarily a bad sign. If people know about it but don't need to use it, that's obviously good, because that means they're not infected in the first place. But we're going to pass 67,000. Actually, we may even hit 70,000 treatments by the close of business today. And again, since we've rolled this out, raised the awareness, our 70,000 treatments are not the whole enchilada, because you have more people now asking physicians about it, more people getting it through kind of the normal healthcare channels as well. And so I think, all that you look, and when you see things like 14 straight days of declining hospital census statewide. I mean, normally when it goes down, but it kind of blips up and down with a downward trend. I mean, this has been 14 straight days, and I think that I think this has kept an awful lot of people out of the hospital, and I think it's definitely saved lives. So that's a really good thing, and we're happy to be here, and we're hopefully that this will be beneficial for the community. Obviously, Flagler, we think some people, particularly St. Augustine and that part of St. Johns County, could do it. Putnam County, I mean, we think this will be convenient for a lot of folks across quite a few different counties. Okay, so thank you guys. I'll take a couple questions before I head on out. Yes.
Governor, I want to thank you on behalf of the residents of the city of Palm Coast. Thank you for bringing these services to our aging community.
Sure.
You're going to get an extra benefit here. I want to also thank Daytona State for cutting the ribbon on their new nursing program.
Yes.
Just a couple of weeks ago. So those new students will get a chance to see how medicine ought to work firsthand. So thank you again.
And maybe we can transition it over eventually where the nursing students can run some of these sites. I think it'd be very good. And the thing that we've seen with since COVID hit was there was a big disruption in the hospitals because they were basically clearing them out for a surge in March and April 2020. Didn't really happen in most parts of the country, but a lot of these the people got laid off, all this stuff. And then, like, the way the staffing works, most hospitals are short-staffed now. There's a huge need, particularly for nurses in these places. And so there's contracting agencies where when you have rising COVID patients, so if you look at the areas where COVID's really rising now throughout our country, they're bringing in a lot of those hospitals have to bring in a lot of contract professionals to be able to work. And I don't know how long that's going to last in terms of that model, but I can tell you, if you're somebody that's coming out with these credentials, and I know they're working hard at Daytona State, and we've supported the budget support for the program, you're going to have a job. I mean, and you're going to be able to be put to work. And so it's a good time to be in this field in terms of having opportunities. You probably will have your pick of the litter, because I've not talked to a single health system that has not raised the issue of staffing needs. And so it's a really big deal.
And as a realtor, we are building 2 medical centers here right now. So we're going to have a technology center for nursing right in the center of town center.
And Governor, at this site, the nursing program will produce 120 new nurses out of this campus.
And I bet you the employment rate is going to be probably close to 100%, which is good.
Governor, do you have any remarks on the hearing happening today on the school mask mandate case?
In which jurisdiction?
In Tallahassee?
Oh, for the stay? Well, look, I mean, you know, we know, since I've been governor, I think any issue that has any type of and I don't know why the masks have politics around it. Let the parents make the decision that's best for their kids. If you want the mask, do it. If you don't, that's fine. But, you know, we have unions involved, and the same unions that wanted schools closed all of. Remember, we were at this time. They sued me to close. We were getting kids back. You know, in the trial courts in Tallahassee, state and federal, we typically lose if there's a political component to it, but then if the judge will lift the stay. If it is lifted, I am confident that that will be reinstated, you know, at the 11th Circuit. It's also important to point out, I mean, you know, we've seen the numbers decline across the board in Florida. When school came, probably by like that 3rd week of August, almost all schools were in. And, you know, you've seen the numbers decline, not just hospitalizations, but cases and all these other things. And it just shows you the folks that have acted like from the beginning of this, the data has never supported that schools are driving community spread of this. And the fact that we had millions of kids go back to school and our numbers are down. And that's true, the pediatric hospitalization down too. Admissions are down too. So I think it shows, and I also think if you look at the statistics, you know, you're not seeing a statistically significant difference between the areas that are following the law and allowing parents to make the decisions, and those handful of districts that have defied the law and are not letting parents make the decision and are forced masking all the kids, particularly these young kids. But you're not seeing a huge difference in terms of the outcomes. For example, Martin County, Palm Beach, right next to each other. Martin, parents' choice. Palm Beach overruled the parents, forced masking. The infection rates are actually higher in Palm Beach, but it's not even significant, the difference. And so that evidence is consistent with what we've seen throughout the entire course of this, and so I'm confident we'll end up winning on appeal in that case. And we've also, we're really, really excited about being in front of the 11th Circuit on our big tech litigation. If you look at that, we didn't think we'd win in the trial court, but you look what the judge said. Judge acknowledged that these companies are not like normal companies. We're not preempted. And the issues that they had with what we did were really, I think, more tangential to the core of what we were trying to do to protect Floridians against censorship and being deplatformed. So that's going to come up there. We also have the immigration case for releasing criminal aliens back into our communities. We think that Biden has a responsibility not to do that. That is going to be in front of the 11th Circuit. So we got a lot of interesting stuff coming down the pike, but I'm very confident on the mask, on the school parents' choice. I think we'll do well. Okay, we'll see you guys soon. Take care. Thanks. Thanks so much.
Thank you.
Appreciate it. Yep. Thanks, guys. Thank you so much. Yeah. Thank you. Yeah, of course.